Today I'm going to give a subcutaneous injection. First, I'd like to talk about the subq sites, which is going to be the back of the arm, the abdomen, the love handles, the top of the buttocks, and the outer thighs. Also, we're going to talk about gauge size and needle length. The gauge size that's allowed is 23, 25, and 26, and needle length is 3/8, 5/8, and 1/2 inch. Before giving any medication to a patient, we're going to go follow the 6 rights. It's going to be the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. We're also going to compare the medication to the MAR, the medical administration record, 3 separate times. When we pull it from the Pyxis, while we draw it up, and before we administer it at bedside. So our order today was to give our patient 5,000 units of heparin. What we have on hand is 10,000 units per 1 mil. The clinical calculation that needs to be done is that we were going to give our patient 0.5 mils of heparin. So once we've gathered our supplies, the first thing we're going to want to do is clean the top of our bottle. We're going to check to make sure we have the correct medication. We're going to make sure it's not expired, and we're also going to make sure that the patient has no allergies. You're also going to want to look at lab values, such as platelet counts and what would be used as an antidote, and in this case it'd be protamine sulfate. So you want to pull as much air out, or excuse me, you want to put as much air into the vial as you need medication. So in this case, it's 0.5 mils. You'll put that air in. And you want to pull the equal amount of medication out. Making sure there's no air bubbles. You want to use the 1 scoop method to get the needle back on the container. And as you see, 0.5 milliliters. So once we've pulled our dosage, we're going to want to get ready and use a new needle. You want to pull off the old needle, put it in the sharps container. From there, you want to take your needle and, using the clean method, insert it while it's still in the package. You want to label this and safely transport everything you need to the patient's bedside. Once you get to the patient's bedside, you're going to introduce yourself. You're going to check for 2 identifiers. Sir, what is your last name and your date of birth? You're also going to check for allergies one more time. You're going to check the allergy band, and you're going to verbally ask the patient if he has any allergies. While you're doing this, you're going to make sure that you've washed your hands, you put on new gloves, and you're going to let him know that you're going to give him a shot in his belly fat. It's a blood thinner. You're going to explain why you're giving him the shot, and it's to make sure you don't get any clots. And you're going to let him know where, after looking at the skin. You decide the best place to do it is in his belly, in his abdomen. Once you've used the alcohol pad, you're going to take the top off the needle. You're going to squeeze 1 inch, and you're going to, with a dart-like motion, put it in at a 45 to 90 degree angle, and you're slowly going to administer the medication. From there, you're going to take your needle and put it straight into the sharps container.